Hello, welcome back to my channel. Today we'll be discussing few memory based questions that were asked for the Aiims Kalyani nursing tutor exam. Let's go to the questions. First question, the action of metoclopramide. So from the options, the right answer is it increases the bowel movements. Next question, which part of the brain is known as emotional brain? Uh, there were the different options. From them, the right answer is limbic system. So the limbic system is a part of the brain that is involved in our behavioral and emotional responses, especially when it comes to behaviors we need for survival, feeding, reproduction and caring for our young, and fight or flight responses. Okay, so limbic system is known as the emotional brain. Third question, premature destruction of RBC is seen in which condition? Among the options, the right option is glucose 6-phosphate dehydrogenase or G6PD deficiency. The etiology of premature erythrocyte destruction or RBC destruction is diverse and can be due to conditions such as intrinsic membrane defects or abnormal hemoglobins, erythrocyte enzymatic defects, or immune destruction of erythrocytes, or mechanical injury and hypersplenism. So from the options, the right answer is G6PD deficiency. Fourth question, oxytocin challenge test is contraindicated in which condition? So the different options were hypertension, hypotension, and premature labor, and one more option was there. So among that, premature labor is the right answer. The oxytocin challenge test or OCT, it is a diagnostic tool that can be used in case of suspected placental insufficiency to evaluate the fetal tolerance of uterine contractions. Okay. This test is usually not performed if there are any signs of premature birth, placenta previa, vasa previa, cervical incompetence, multiple gestation, or previous classical cesarean section. Other contraindications are also there, but they are not limited to previous uterine incision with scarring, previous myomectomy entering the uterine cavity, and premature rupture of membrane. Any contraindication to labor is a contraindication to OCT. So the right option is premature labor. Fifth question. These questions were asked in the aptitude section. So the fifth question is Raj Kumari Amrit Kaur is related to which hospital? So among that, the options were like NIMHANS, Jipmer, Aims Delhi. So the right answer is Aims Delhi. Next question, which Aims is included in phase 1? So the right option from that is Aims Rishikesh. Only Institute of Medical Sciences, it's a group of autonomous government public medical universities of higher education under the jurisdiction of Ministry of Health and Family Welfare, Government of India. So these institutes have been declared by an Act of Parliament as Institute of National Importance. Aims New Delhi, the forerunner institute, was established in 1956. In 2003, the Government of India announced the Pradhan Mantri Swasthya Suraksha Yojana, that is PMSSY initiative, which aimed at correcting the regional imbalances in the availability of affordable or reliable tertiary healthcare services. So PMSSY was officially launched in March 2006, and 6 Aims-like medical institutes were announced for underserved states like Patna, Bhopal, Raipur, Bhubaneswar, Jodhpur and Rishikesh. Okay, so the right option is Aims Rishikesh. Next question, INC works under. So the Indian Nursing Council works under Ministry of Health and Family Welfare. The right option is Ministry of Health and Family Welfare. So INC or Indian Nursing Council is an autonomous body under the Government of India, Ministry of Health and Family Welfare, constituted by the central government under Section 3(1) of the INC Act 1947 of Parliament in order to establish a uniform standard of training for nurses, midwives and health visitors. Next question, order of courses according to the year of study under INC. Okay, so that's ANM, GNM and BSc. Different, it was given in a different orders. So the right option is ANM, then comes GNM, then BSc. Okay. Last question for the day. So, which is a constituent board of Quality Council of India set up to establish and operate accreditation program for healthcare organizations. So, NABH, you may have heard about that. NABH, National Accreditation Board for Hospitals and Healthcare Providers. That is the constituent board of Quality Council of India, which checks the quality care in of hospitals. Okay, so these are the few questions that we'll discuss today. I'll come up with the rest of the questions in the next video. Thank you so much.